That's mine. Okay, thank you very much. So welcome to the International Conference on Dupuytren disease. And, well, I still don't find a way, this one, okay. And I'm very pleased to see so many people here interested in this disease because I have it myself, so I'm a patient, and it's a pleasure to see that interest. So I have no conflict of interest to declare, of course. And first, to introduce myself as patient, just a quick look at my Dupuytren history. My first nodules developed 43 years ago, which is quite a time now, by now. And at that time, it was nearly immediately irradiated. That was by chance because a friend of mine, a medical doctor, just had heard a talk on the possibility to irradiate or radiotherapy of Dupuytrens the day before he visited me. So that's how it started for me. But the interesting thing is, after 43 years, that finger still has no contracture and no side effects. So that was very impressive for me. And when I developed the second nodule on the other hand, I first didn't do anything because I thought maybe it will go away by itself. At that time, I still was dumb. And of course, it didn't go away. And I had to have a partial fasciectomy 25 years ago. But again, this finger now, still straight, hardly any scars, wonderfully done. But there is a but, and that was immediately after the surgery, I had rapid extension into other areas. I developed 3 new nodules in each hand. So I panicked a little bit at that time. Finally, I found someone who could treat it again with radiotherapy, and now that is stable. You can still feel where the nodules were or the cords which had developed, but no progress anymore. Finally, on this finger, I had Xiapex and needle fasciotomy, and both with recurrence after I stopped wearing a splint. But the finger is not really an issue, and I can live with. I don't treat it anymore. And I have 2 small Lederholt nodules, which are stable and don't cause any problems at all. So I know where they are, but that's it. Okay, now let's get into the presentation finally. The International Society is a collaboration of physicians, and I'm a physicist, but these are physicians and patients, and the "and" is very important. So this is, I think, the real value of this organization, that patients and physicians collaborate with the same goal. It's a joint interest and action group, and we want to support the research of this disease. We want to better understand this disease, and we want to support patients. It was founded originally in 2003 and has been the International Society has been a separate entity since 2010, and that's how it all started. So 2 younger guys than today, but we're still going strong. And the society is located in Germany. It could actually be anywhere, of course, because it's a global society, an international one. But that's the view of the location of the German society, so not so bad after all. And now putting faces to the organization, we have Charlie Eaton, Heinrich Segenschmidt, and myself as chairman of the International Society. We have Anne Schurer of the British Society, Paul Gauthier of the Canadian, John Christiansen of Danish Society, and Leo Sparreboom of the Dutch Society. All 4 are patients. I myself am also heading the German Society. Charlie is running the Dupuytren Research Group, and he will tell us more about his work shortly. And finally, we have Giorgio Pagliardi of Italy and Andre Zigalo from Russia. And you can see it's a mix of patients and physicians again. And the organizations are actually doing different things. For example, the British Society is very strong on Facebook, very strong on these media. The Canadian Society is in the process of creating a Canadian Dupuytren Award, which will be interesting. The Danish Society is just in being started. So if here is anybody from Denmark, please talk to John and join the society, make it strong and growing. Leo Sparreboom and the Dutch Society are very good in setting up contact via presentations and events to patients. The German Society is running patient supporting groups all over the country, something which is very popular in Germany. So these are self-organizing patient groups which inform other patients about the disease and how to handle it. Charlie, of course, is very strong in research. Giorgio Pagliardi is an expert in collagenase injection, of course also a hand surgeon. And Andre Zigalo is probably the one who runs the biggest center for needle fasciotomy worldwide. At least he is one of the centers, or his clinic is one of the centers for treating Dupuytrens in Russia, in St. Petersburg. So you can see and meet most of these people here later in the conference. Not all are here, but many. So one of the important things that we are doing is organizing this kind of conference. And the first one was in Miami in 2010. And the proceedings have been published as a book by Springer. And the next conference was in Groningen, and as already mentioned. And again, the proceedings have been published as a book. You can see all presentations on videos on our conference website. And later this year, we'll also put the videos of this conference on the website. So you can see or you can listen to the old presentations as well. But I also recommend to have a look into the published books because they contain more than the conference and the chapters are more elaborate and they have several very basic, very interesting, very fundamental contributions. So if you have time, have a look into those books. Another thing that we are doing regularly and also very important is to encourage specifically young researchers is the annual International Dupuytren Award. It recognizes exceptional scientific publications on research and clinical treatment, so we support both on Dupuytren and Lederhost disease. And the applicants should not be older than 45 years. The older ones already have enough honors, so they don't need the award anymore. And the winner is jointly selected by our scientific advisory board and the managing board of the International Society. And very interesting, the first winner in 2010 was Ilse de Greve, and this is a good opportunity to thank you for organizing this conference. You've done great. So the question is, what did we achieve in the last 15 years? Where do we stand today? We made big steps forward in raising awareness of the disease and in boosting a little bit, at least, the research efforts. New treatments were established, and collagenase actually in the last 15 years was a real new treatment. The other ones, like needle fasciotomy, was somewhat popular in France, but not elsewhere. So it extended, with the help of Charlie and Gary, to the US, for example, and in other countries, for example, Germany. And radiotherapy was known in Germany. It was not really popular for Dupuytren's, but it was known that it works. And it's now available in Australia or in the US or in the UK. So beyond that, we were able to start cooperations between hand surgeons, therapists, and radiotherapy, and including joint projects. For example, radiotherapy after surgery is one which is ongoing, or using splinting after needle fasciotomy is another one. And surgical techniques were improved, adjuvant treatments were found. And a big step forward was in analyzing involved genes. So there we made big step forwards. And also in researching cells and the cell matrix. And I forgot on this list a very important one. The involvement of patients has greatly improved in the last 15 years. And that might hopefully, or is hopefully, changing a little bit the way how we look at treatments by including the patient in the view and the patient satisfaction. The surgery or the treatments are not to satisfy the physician. They are to satisfy the patient. So got to be included. And we made big progress, in part or mainly, let's say, due to the internet, where people can get information, read it, understand it. So the patients today are much more educated. When we started nearly 20 years ago, I looked at the internet and there wasn't anything on Dupuytren's. A few comments and that was it. So that has changed dramatically. But still, in my view, we understand so many details today, many new details, but we are still missing the picture, the full picture. We are still not understanding the disease. And that is the real challenge for the forthcoming years. And to give you an example, just a handful of open questions. For example, we don't know why and how this disease really starts. What we are observing when we diagnose Dupuytren's is a nodule in the palm, but that's a late stage. That's already developed from something much smaller, and we don't know why it developed there. It's a local disease. It's not a system. It has systemic components, but the disease starts locally, so it must have a local trigger at least. So related to that, why is it in the hand, and why, for example, don't I have Dupuytren's in my earlobe or my belly? And this is an indication that the use of the hand and the applied forces and the activity of the hand are fundamental to understanding the Dupuytren disease. Another aspect is why has Dupuytren's such a strong age dependence. I think it was in Miami that Hanna Milesi indicated that he was measuring a breakdown of the elastic structure of the hand. Might be one of the reasons, but obviously something wears down. but we still don't know what it is. Another observation, which I find very interesting, is why do chords vanish when the finger gets stiff? And this, I think, is a strong indication that the applied forces in the normal use of the finger are really causing and building up the chord, the Dupuytren chord. Because if the finger is no longer in use, the chord vanishes. And finally, why do about 80% of the Dupuytren patients never need treatment for their disease? And this is an important aspect. For example, when you consider radiotherapy, you would not like to irradiate 80% of the patients without any need for it. So you have to be careful by selecting who gets what treatment. But the other aspect, and that was proposed years ago by Ghazi Rayan, the idea was that there might be an aggressive form of Dupuytren's, and a less aggressive form might even be two diseases. So overall, I think for understanding Dupuytren's, we need to bring together all the fraction details that we know and include in the full picture the biomechanics of the use of the hand. If we don't do that, we'll never understand it. So understanding the full process means to understand Dupuytren's pathogenesis, finally. And that is the perfect transition to the next paper by Charlie Eaton, and he is talking about Dupuytren's pathogenesis. Stage is yours.